Some people are joining now. Just give it a few more seconds before I start with the introduction. Okay, I think we can make a start and then other people might join when they're ready to do so. So, hello everybody. Hopefully you can see the background slide. Thank you everyone for attending. It's been a while since we had a webinar related to the social care statistics group. So I'd like to thank you all for participating. Today we've got an interesting presentation lined up on synthetic control methods from my colleague Gintare. Just as a bit of an overview of the structure of this session. So as opposed to some previous ones where we've had two presentations, we thought we'd mix it up a bit. And this time we are going to start out with a presentation and then actually have some time reserved for some small group discussions in breakout rooms, just so that people have a chance to be more active participants in the group. And this should also give people a chance to get to know each other. Yeah, so we're going to start off with a 20-minute presentation, followed with 5 or so minutes for questions, followed by 20 minutes for the group discussions, some time for feedback afterwards, and then a final few minutes reserved at the end for a small note on a catalogue of social care measures and an invitation for topics for future discussion. So with that brief introduction out of the way, I'd like to hand over to Gintare for her presentation on synthetic control methods.
Hello, everyone. Just very quickly, I'll try to upload my slides. Can everyone see? If I could just have a couple of nods.
Yes.
Okay. So.
Although, sorry, it's not in full screen mode at the moment.
No, not. Okay. Is this better now?
Yes.
Right.
Thank you.
So, hello, everyone. I am Gintare Amritpal. I work as an economist, as a researcher in Personal Social Services Research Unit, PSSRU, in University of Kent. And today I was invited to give a short introduction to the synthetic control method. It is not going to be overly technical. It's a method I have used a few times, and enjoyed using it tremendously because it's a lot of fun. But in consideration that I was told it's not going to be a particularly technical or going to be a fairly mixed audience, so it's not very technical, and it's just to share a few insights and examples. So first of all, this method was proposed by Abadi and colleagues in 2 articles in 2003 and 2010. And it's an interesting method to consider when there's a relatively small number of treated units and a relatively large number of control units, and when other possible estimation techniques do not necessarily work that well. So in this presentation, I will quickly go through the main principles of the synthetic control method, then some examples of application and coding in Stata, some examples in general of how it has been used in the literature, and will conclude briefly. So, first of all, in regular estimation of the treatment effect in econometric analysis, is normally based on comparing the outcomes of the treated unit to the outcomes of the untreated unit. However, there's frequently an issue when untreated units are not quite similar to the treated unit, leaving the estimates biased. So the synthetic control unit method suggests that why, instead of comparing treated unit to dissimilar untreated units, why not construct our own synthetic untreated unit and compare what would have happened with the outcomes in the absence of the treatment. So this way, synthetic control unit mimics the treated unit prior to the treatment and then predicts what would have happened with the outcome post-treatment, assuming the treatment has not happened. So essentially, it's an estimation what would have happened if with the outcome variable in the absence of the treatment. So synthetic control unit is constructed given different weights between 0 and 1, so they're all positive, and they sum up to 1 to the untreated units to create a synthetic unit that is mimicking the behavior of the treated unit based on a list of the variables defining both units. The list of variables is important because through this list you would compare the synthetic control and how similar it is to the treated unit, and also this list is similar to the control variables, suggesting that it should be important to defining the outcome variable. All the most similar units are used to creating the synthetic control unit, and this method suggests a different list of ways to ensure that happens. So donor pool is what is called all of the list of the untreated units that is being used for the creation of the synthetic control unit. And there is some donor pool restrictions that one should consider before using this method. Is those units that are in any way affected by the treatment should be excluded from the donor pool. So even though they were not directly affected, but affected by some, let's say, spillover effect, they shouldn't be included in the donor pool. Also, those units that have large idiosyncratic shocks also should be excluded from the donor pool, as that would, again, make the estimates less exact. Normally, this method requires a fair amount of data, especially prior to the treatment. Prior to the treatment, how synthetic control unit is matching and following treated unit is what gives credibility to this method. So if it tracks the treated unit fairly well, and if the characteristics between the units are fairly similar, then it is easier to trust the estimates of this method. It also is useful if you have a sizable number of post-intervention periods, because frequently the treatment effect is gradual and changes over time, and this method specifically allows the treatment effect to be different over time. And in order to test how well the synthetic control is working, it offers placebo tests, which is taking every untreated unit and calculating its own synthetic control and then treatment effect for each, and then considering comparing these effects with the actual treated units estimates. And it offers robustness checks, which is mainly excluding units that are given positive weights in the creation of the synthetic control unit. And even though that impacts goodness of fit measure by them being excluded, it gives an estimation of how robust the estimates are based on including every single untreated control unit. So following the example given by the authors from the Abadi and colleagues in 2010, there is a couple of tables that show how this method works. So the table on the left shows the weights given to different states. Sorry, I forgot to mention that in this example, Abadi and colleagues estimate the effect of the cigarette sales tax in California introduced in 1988. So this is where excise tax was increased by 25% per pack of cigarettes, and how this impacts cigarette sales onwards. And California is being matched to all the rest of the 38 states in the US, and you can see the weights given to all of these states, from some states being completely excluded, where the dash is, to given 0 weights and to given positive weights, so only 5 states in this case, which contributed to creation of the synthetic control. And the table on the right shows how similar and dissimilar the actual California compared to synthetic California and compared to the rest of the states in US are. So real California and synthetic California share fairly similar characteristics upon the list of the control variables. And you can see that there's a significant difference considered in comparison to the rest of the United States. So this is how it's an indication how the synthetic method potentially offers a better comparison and a better estimate for what would have happened with the treatment effect. 2 graphs of it here. On the left-hand side, it's a comparison between actual California, were indicated by the solid line, and the rest of the US indicated by the dashed line. And you can see that per capita cigarette sales are considerably different between the two, even prior to the treatment in start of the Proposition 99 in 1988. And the right-hand side graph offers the fit of the synthetic control California, again offered in the dashed line. And this is where synthetic California fits actual real California much better prior to the treatment in terms of outcome measures. And then you can see a significant diverge between the 2 outcomes after, which is quite beautiful to see in terms of method work. So this is an example of how placebo tests work. Each line indicates, so the solid line indicates the treatment effect of actual California. And so it's the difference between synthetic control and the actual real outcomes of the California. So prior to the treatment, it tracks each other fairly well and then diverges. Each other line are each separate state being considered as a treated unit, and then measure the difference with its synthetic control and what is the treatment effect regarding this. So as you can see, there's quite a lot of outliers and idiosyncratic shocks. So some of these states are not good comparisons for California. So moving to the right-hand side, this is after removing certain states from the donor pool, you see a much better performing placebo tests. So there's no more outliers, there's no more idiosyncratic shocks. The behavior prior to the treatment is similar with all of the placebo units. And then you can also see that California is significantly different from the rest of the placebo units, which is part of the indication of its statistical significance. So statistical significance is assumed when the treated unit behaves significantly differently in terms of treatment effect compared to the placebo tests. So in terms of Stata, there are a few packages that I know of that run synth command. The first one was created by Jens Heinmüller, one of the co-authors of Abadi, and this package is available for MATLAB, R, and Stata. And then there's a couple of other packages. Another one, Synth Runner, created by Galliani and Christoph, which update the synth command to conduct multiple estimations, help with inference, diagnosis, help with generating visualizations, and so on. Also, AllSynth, also built on synth package, helps with bias correction and for matching on predictor values. And so overall, all of these packages are useful to check out, as they can help with some of the difficulties of this method. So a couple of small things to note in terms of running it on Stata is this method requires of controlling for the outcome variable prior to the treatment to ensure that the synthetic control is as close and as similar to the actual treated unit, and also does not produce beta coefficients or standard errors. It only produces predicted outcome points and its p-values. But it's all part of the, it doesn't assume a linear or the same treatment effect. The treatment effect varies over time, so it's part of the reason how this potentially is more like real life. So this is a couple of examples of the same example considered earlier, but in terms of how Stata how it's run in Stata. So Abadi proposes this list of control variables upon which you match your synthetic control, starting with the outcome variable and then personal income, proportion of those between 15 and 24 years old in population each year, retail price of cigarettes, beer consumption, cigarette, and then outcome variables for 3 years, 88, 80, and 75. Also, it's important to indicate, it's important to indicate the treated unit and the treatment period. On the right-hand side is a comparison with a different way of estimating the same synthetic control method, but with a different list of controls. So there's no other controls apart from indicator each year controlling for the outcome variable. And this actually produces a closer fit of the synthetic control. And in a way, the treatment effect does not really look that dissimilar. So this is an example of what Stata output would look like. So these are post-treatment time periods and the treatment effect. So that's the difference between synthetic control and actual treated unit. And it's, as you can see, the treatment effect is negative, it's p-values and standardized p-values. So they show the comparison, the significance of this effect, and compared to the null hypothesis that there is no effect. Another example also suggested by the same authors is the economic impact of 1990s German reunification on the West Germany. On the left-hand side graph, you can see that the rest of the OECD countries don't really remind West Germany exactly. They're quite different. If the right-hand side graph is proposed synthetic control estimation, which tracks West Germany prior to unification fairly closely and shows what the outcome would have been in the absence of unification. And the table on the right-hand side shows how well the synthetic control matches West Germany, which is fairly well compared to the rest of the OECD countries. So these examples are still of a single treated unit compared to multiple untreated units. In this example by Krief and colleagues, it considers multiple treated units. So it's a hospital pay-for-performance scheme in Northwest England. So with multiple hospitals participating in this scheme, and how it affected 30-day hospital mortality. Pay-for-performance scheme incentivizes certain outcomes and providers' income partially depends on it, on the performance on certain outcomes. So on the left-hand side graph, there's a comparison between averaged Northwest England providers and the rest of the England in the dashed line. It is fairly visible that both are quite dissimilar from each other. However, they track each other's movements fairly well. And this is where the tests reveal that the parallel trends assumption cannot be rejected in this case. So something like difference in differences estimate is actually applicable and could be well used for estimating the treatment effect here. And on the right-hand side graph is the proposed estimation of the synthetic control method and a suggested difference between what would have happened in the absence of the treatment. This graph shows a comparison between the two methods, and in general, this article is useful for having a look at both methods and how they compare with each other. And as you can see, the treatment effects are actually quite different. And for using the difference in difference approach, there's more statistical significance found in the treatment effect. While using synthetic control unit, it shows much less significance in the effect observed. So this raises a question how well synthetic control unit works, but at the same time, potentially it's still debatable and could be both, because technically in the right-hand side example, it matches the behavior of Northwest England better. Another example by some of my colleagues, Better Care Fund evaluation, also suggesting a lot of multiple treated units. To be fair, all of the units in the sample are treated. So this is a fairly cheeky case of an example, as normally with a synthetic control method, you would want to eliminate from the donor pool units that in any way are contaminated. So those that have already in any way been affected by the treatment. So in this case, Better Care Fund was allocated across all of the local authorities in England, and local authorities were simply receiving a smaller or a larger sum. So in order to indicate which units are treated, there's a couple of different estimations. And one of them on the shown on the left-hand side graphs is when the top half of BCF funding receiving local authorities are treated as treated units, and the bottom half of the local authorities receiving BCF funding are considered to be not treated units. And then seeing the difference between the two.
Sorry, Gintari, you have a couple of minutes.
Oh, okay, right. I'll try to hurry up. So on the right-hand side, it's considering the top quarter of local authorities with top BCF funding as treated units, and the rest 75% as not. And there's also a robustness check, and as you can see, in a way, it still offers fairly similar results. This is an article that we had a pleasure of publishing, looking into how urgent and emergency care vanguard affected delayed transfers of care. It's a quite nice example because, as you can see, comparing the urgent and emergency care vanguard partner sites, so 29 local authorities, it is fairly different from the rest of the England local authorities. However, after the applying synthetic control method, you can see the nice difference between the two. So this is where parallel trends assumption wouldn't hold, and this method is a much better application for finding out the treatment effect. So a quick comparison between methods. In contrast to difference in difference design, so synthetic control method does not give untreated units the same weight for the comparison unit. Then normally for the regression estimator, it can be expressed as a weighted average of comparison units and restricted to the weights sum to 1, but normally it cannot be restricted for the weights to be between 0 and 1, which synthetic control method does. In synthetic control method, contribution of each control unit is explicit, and you can see that as shown in a previous example, and it's in the end compared only with the most similar units. And then most regressions are based on extrapolation, while synthetic control method avoids it because it only deals with the existing data. So difference in difference approach requires parallel trends assumption to hold, while synthetic control method does not need it. So quick conclusions: synthetic control method is useful when no single untreated unit provides a good enough comparison and a match for the treated unit. And then that complicates the calculation of the effect of the treatment. Also, when other methods are simply not appropriate to be used, it offers a nice insight into what would have happened without the treatment and without having to use extrapolation. And it's great as a visual representation. And the only difficulty is that does not offer what is normally expected from the econometric analysis, does not offer beta coefficients and standard errors, and it's becoming more popular, but the literature is still scarce. So this is where there's more and more articles being published using this method, but so far there's few that would use solely this method and would not be using other methods next to it for comparison. This is a list of references in case you find it useful. And thank you so much for listening to me. There's my email address if you'd like to drop me a message or ask anything.
Thank you very much. That was really interesting. Can I ask if anybody, well, we have a few minutes for discussion, for questions before we separate out into breakout rooms. Can I ask if anybody has anything that they'd like to raise? Please do either raise your virtual hand or unmute yourself to ask a question, or otherwise write it out in the chat. Javiera, yes.
Hi, thank you very much. So I was just wondering about, I've never used this method, so I don't know much, but I was wondering about the number, let's say in your example, countries or hospitals that you should have in order to create this synthetic control. Do you need a lot of them, or is it 10, or is there any rule?
So I think technically you wouldn't necessarily need a lot of them. It's just nice to have some donor pool that you'd be able to choose from in terms of to choose only the ones that are most similar. So once you go through donor pool restrictions and placebo tests, if you can eliminate those that basically don't behave in the way that you would want for your synthetic control. So basically you only choose the best matches for your treated unit. But other than that, it doesn't have to be a lot. Normally it always uses only a few untreated units to create a synthetic control. So as long as those match fairly well, should be enough.
And when you say match, how do you measure that? Or is it just like trying a graph visually that they match, or is there any criteria?
So in one of the first graphs that I shown, that normally you would match them on the list of the control variables. So let's say these control variables would explain the outcome variable. So pretty much the same as in the regression analysis. And you would be able to see the means of those control variables in the table basically created. In the table that would compare the actual treated unit with the synthetic unit. and on the means of all of these control variables, and also compare it to the rest of the untreated units in your sample. So, and this way you could see if they are close and similar to each other or not. And also the graphical visual representation of the outcome is also a good indication. And part of the credibility of the method also rests on it, that you see that it tracks the actual treated unit fairly well visually.
So I think if we have quick time for one final question from Joseph before we break out into groups. So Joseph, I don't know if you're on mute at the moment, perhaps.
Can you hear me?
Yes, we can now. Yes. Thanks.
Yeah, thank you. Yeah, I was asking, do you need to have a balanced panel? You, in terms of the observations, do you have to have them? Do you have to have a balanced panel, or you can use it with an unbalanced panel? Does the panel need to be strongly balanced? Or?
So I only have used it and have observed it used for strongly balanced panels. So to be honest, I don't know how to answer this. I don't remember reading exactly what are the requirements, but so far I would go with that would be useful.
Thank you. I think now, if we're able to do so, we'll break out into small rooms, and if we could start by having a round of introductions to get to know each other. And then I think Daniel has a list of a few questions that we have planned to talk about, predominantly on application of synthetic controls, but also some others in case they're of interest. So perhaps, sorry, one other thing is I think the group should have nominated someone to feedback after we come back together, but if not, can I ask that you just confirm who that will be at the start of the discussion? So I think we'll come back at about 10 to 2. So if, Daniel, when you're ready, please do filter us into the rooms. Great. Thank you very much, everybody. Hopefully you all had a useful set of discussions. Now I think it would be useful to, for the people nominated to feedback, just to speak briefly on what they ended up discussing as part of their group. So can I ask everybody who ended up saying that they would feedback, can I ask you all to raise your hands virtually, and then I can call on individuals. Sam, I see your hand raised.
Yeah, I don't know what it is about Zoom. I can never ever find the hand raise button.
It's under reactions.
It should. Oh, there it is. Yeah, I think I clicked the little arrow and it just said recognize hand raise. Right. Okay. So firstly, I guess we all thought we thought it was an excellent presentation by Gintare. Well, certainly I was not very familiar with the method at all, and yeah, there was good. It was kind of impressive the way that the weight works so well to sort of create some sort of potential, some sort of reasonably convincing counterfactual. So we like that. In terms of, do you want me to answer all of the questions, Amritpal?
Just if you can give a brief overview of the general discussion or the main points that you spoke on.
So in terms of the second question, which I didn't write down, I just remember, what was the second question?
Oh, it was apologies, we actually didn't get to that. We only spent the entire time on number one. The second one was, what are the key challenges for statisticians working in social care moving forward?
Right. Yes. So the second and third we kind of talked about together, or we said similar things anyway. So which we basically thought challenges were data quality, and there's just a very large amount of data cleaning that you need to do when you get data, even from sort of official data sources, like NHS Digital, let alone from local authority administrative data. I mean, we particularly, things like areas change over time. If you're looking over a long period, you'll have PCTs and then CCGs and ICDSs and all of this stuff. And also, area boundaries change over time as well. And that is that can cause difficulties. And the other, a couple of other big things. We thought that, also, it was highlighted that services are very different between areas. Services that people are actually offered. There's a lot of heterogeneity, both in terms of the types of the populations of areas and in what people receive. So that it can be very difficult to do these kinds of, to think about what is a good control. Because places might just be people might be offered quite different things depending where they live. And we also just thought a lot of the stuff that is actually really important to people is quite hard to measure. So when you get a bunch of data, it's very difficult to know. I mean, even things like delayed discharges are reasonably open to interpretation in terms of what actually counts as a delay, and do different local authorities do it differently and stuff. And so there's there's lots of data that just isn't. I mean that delayed discharges, there is data on that, but there are lots of other areas where things like ASCOT have taken a long time to develop to measure quality of life, and that's good, but there's lots of other stuff that's just basically very difficult to measure. So that is kind of a challenge. You might go into this as a new researcher with lots of questions and realize the data is just not there to answer those questions.
Very true. Thank you. So Karen, do you have a quick any points to add to that you discussed in your group?
So apologies to my group, because we didn't actually talk about who was nominating to feedback. So my group, just jump in if I've missed anything. So just repeating that it's an excellent, we thought it was an excellent presentation from Gintari. We can see a number of positives with using the methods in terms of using this as a control group when it's not possible to have a control group, and also quite often as researchers we ask local authorities when it's a new policy to recruit to an intervention group, for example personal budgets and social care, and then also people to we ask them to recruit to a control group, so they will be receiving conventional service delivery, and quite often that's a hard message to tackle when there's a new intervention. So we thought there was a number of positives around synthetic controls. One issue we covered is that how do you judge similarity between the two groups, the treated and untreated group, and whether there were assumptions that should be met of how similar those two groups are. But that was just one challenge we thought about. And we spent a lot of time on synthetic control methodology, but we did go on to question 3 about common issues related to analysing data related to social care. One of the main issues is linking data sets and using a common identifier we thought that social care data is more fragmented compared to health. As we've seen, varied types and quality of data that's recorded, and also research governance and the required process to actually gain that administrative data could also cause problems, and has caused problems for researchers.
Very
so that's
true.
from my group. Hopefully I've covered everything.
That's great, thank you. Apologies, I think, well, in the interest of time, I promised Ed that I'd give him a few minutes at the end to talk about the catalogue of social care measures. I think, Ed, do you have any slides that you wanted to show?
Yeah, sure. I'll quickly just share. I think it's easier just to share my whole screen, to be honest. Or just for now, hold on. I can't see how to do it. I'm just going to go for it anyway. So hopefully you can see now just some slides. I just put a link to the catalogue in the comments section as well. Basically, just very quickly, it's just to show people, some people might be aware and some not, that we have recently created a new catalogue of social care data, well, of the measures, a bit like what Karen was just saying, the fact that social care data is so fragmented, but actually there is an increasing amount of it. We've tried to bring it all together. So what we've done is we've found large UK data sets. We've recorded lots of information about the data sets, and then we've gone through all their study documentation, or any ways such as kind of Excel templates, however they collect their measures, and we've listed all the measures we could find related to social care. So essentially what we've got is a massive list. You can search either via data sets, or you can search down the huge list of all the measures from all the data sets, and all of them will concern social care. So we've gone through each of these data sets and only brought in the measures that concern social care. We don't provide the data itself. This tool is just to help people know what is out there. And just in the sake of time, very quickly, I can show you, if I just share my Google Chrome page now. So what we've got is there's two basic ways of searching through everything. You can have a bit more look. I've put the link on the chat, so hopefully you can have a bit more of a look here. But basically, here's the all data sets method. What you're left with is a long list of all 43 data sets. Hopefully there'll be more in the future that are listed as part of this catalog. And then you can filter these data sets themselves for lots of different things. You know, you might go for just birth cohorts and that brings it down to 4. You might filter the age of recruitment. Well, I can't for that one, but because there's only a few. But you could filter the age of recruitment, maybe, I don't know, 22 to 50 or whatever it is. And just kind of, that will obviously filter the amount of data sets you're looking at. Then once you click on a data set, you can see all the measures related to social care from that data set. So you can see there's a big list like this of all the different data sets, all the different measures, with a brief description of what they're about. If you click the plus, you can actually see what the question or data item was and what the response scales were. And you can export them as Excel documents or as CSV or as PDFs. The other way of searching is very similar, but you literally look at all the measures. So at the moment, you've got a long list of 2,516 measures. These are from all the different data sets on the website. And again, you've got this thing called a custom search builder where you can, for example, specify that all the questions are only about need of social care. You could add that the informant must be, I don't know, maybe a carer. And you might look for specific responses so the response scale, the answers that contain learning disability, for example. And who knows, we might get, we've got one entry. So there we go from, I think this is the survey of carers and households. We have one question that fulfills those criteria. So, of course, then you can export it Excel or CSV or PDF. I know we're kind of short for time, so might just finish there, but it's just so that everyone's aware we've made this website. And I guess now we want as many people to know who might be interested or might see value in it to be using it and going on it. So please share with whoever else you might think would be interested. And that's very, very quickly how it works. We've got a video and everything to explain if you need more info.
Thank you very much. That was brilliant. And I know that this was a really, it's a really useful resource. So yeah, I echo your sentiments in hoping that other people will be making use of this. In order to wrap up, I'd just like to thank everybody again for attending. Thank Gintare for a brilliant presentation, and yeah, for the useful follow-up discussions that emerged. So thank you, everybody. I hope you have a good rest of the day, and look forward to seeing you at the next webinar that we put together. We didn't have time to talk about potential topics, but that's something that we might be going on to try and find out views about moving forward. Great.
Thank you. Bye.
Thank you.
Thank
Bye.
you.
Thank you. Bye. Bye.
Thanks,
Bye.
everyone. Bye.